Hello everyone, welcome to my channel. This is Dr. NEEHANEMANI and I'll be joining my residency in DNB medicine soon. So in my previous video, I talked about how and why did I choose DNB medicine in Mumbai over MD medicine in some peripheral place or a three-tier town. So taking it forward, in this video, I'll be discussing about how did I decide my order of institutes for choice filling. I found out that there are two most commonly used methods by everyone to arrange the order. One is that they arranged it based on the ranking and popularity of institutes amongst the toppers, and the second one is relying based on the previous year cutoffs. However, I feel that both these methods are incorrect. What one should do is a thorough research about that institute by talking to the resident, visiting that place, and deciding their priorities and criteria, and then make a personalized order or sequence of institutes. And that's exactly what I did. So, the points or criteria that I used for deciding my order or sequence were firstly clinical skills or hands on. As we know that DNB is offered mainly in private hospitals or charitable hospitals, so getting independent hands on at resident level is an important thing. You should learn the clinical skills and procedures in your residency, is what I feel. One may say that we will be doing OPD based consultancy or OPD based practice in future, so we do not need to master the clinical skills as such. But I feel that this is your only chance, and this is the only period where you can learn those skills by making mistakes and then learning from them, and then you must do it. You should do it. Okay. So, and again, independent patient handling or hands on is a drawback in corporate hospitals. So, you may want to consider that thing in mind before deciding for your institute. Okay. Especially in branches like in surgical branches where hands on is a must. Adequate hands on, or what we say as cutting, adequate cutting is very much important to learn proper surgical skills, and that again is a drawback for corporate hospitals. So, research thoroughly about this point and also make sure that you get enough OPT exposure during your residency. Okay. Second point that was is the academics. So again, academics is a bit academic gets a little more importance in DNB compared to MD, because obviously the DNB exam is a little bit difficult to qualify, and I feel that if you be in touch with the academics for 3 years, it gives you an advantage to prepare for your final exams. Also, NBE has given some guidelines to the institutes for regular conduction of PG activities. So, also discuss enough with the residents how the academics are in that particular institute, like the case presentations, journal clubs, seminars, grand rounds, etc., because it helps you learn the examiners or the professor's perspective about that academic thing, and also it keeps you in touch with your academic throughout. Although in the first year of residency it is a bit difficult, but still try if you can, and do make sure that the consultants teach on the rounds. Okay. Third thing is super specialty exposure. In broad specialty branches like medicine and surgery, getting adequate super specialty exposure during your residency program is very important. In most of the hospitals which I inquired, or mostly everywhere, the second year of residency is particularly dedicated to super specialty rotational postings, including ICU and casualty. Then duty hours, what I found that in places where there are two seats of a particular branch, there will mostly be alternate day calls, so you might want to put that institute a bit lower in the order. Then a few miscellaneous points like stipend to there's NMC and NB guidelines, which says that there should be equivalent stipend for MDMS or DNB in that particular state. Hostel, so some of the private hospitals might not give hostel facilities, so inquire about that before opting for that hospital. study leave. So a few hospitals give separate study leave at the end of just before the final exam. A few of the hospitals do not. You have to adjust amongst yourself. So, but I feel that a dedicated study leave gives you an advantage to prepare for your final exam. Mm, toxicity. So as such, there's minimum toxicity in DNB, but still you may research more about it if you want. Leaves. So, as per NBA guidelines, 30 paid leaves are allowed throughout the 1 year of residency. However, you might not need that much leaves. People usually take 10 to 15 leaves, but in just in case. But yeah, but you must provide a replacement if you are on leave. And for that, it totally depends on the mutual understanding between you and your co-GR, and it's the case everywhere. Also, if you're a person like me, you might want to consider the proximity of the institute from your home place. So, yes, I think these are the points enough on the basis of which you can decide the order of institutes you would want to fill for choice filling. And yeah, so that's it from my side. I hope that you found this video helpful. If yes, please do like, share, and subscribe to my channel. I'll put the links of my Instagram and Telegram in the description box. Feel free to connect. I'll try to make more such helpful videos for you. Till then, bye bye, take care, and happy residency.